Hello everyone. Today, I'm going to cover a clinical topic that would give you an insight into what goes on in your doctor's mind when you present with indigestion. A clinician generally views indigestion as a symptom, meaning we try to find a cause for it. A typical history would be a middle-aged adult saying, "Doctor, I have a burning sensation or discomfort in the middle of my chest or upper abdomen that wakes me up at night. Used to come and go, but now it seems to be there all the time. I have tried some antacid, but it's not helping as much anymore." A follow-up question would be to understand what your fears are and any ideas you may have had about the symptom you presented with. We would also ask you how indigestion has impacted your daily activities, especially around diet, work, sleep, or mood. After summarizing your history with the key points, your doctor's brain cells start firing and go off with a few follow-up questions to consider possibilities like heart, liver, gallbladder, pancreas, medications, or alcohol consumption. If there is little history to support any of these alternative causes, we'd usually consider if you have any alarm symptoms like difficulty swallowing, persistent vomiting, blood in the vomit, weight loss, or feeling of a lump. Usually, we can double-check any of these with a physical exam by charting your weight and examining the abdomen, and may consider ordering a blood test to check if you have iron deficiency anemia and a stool test to check for a bug called Helicobacter pylori. We would explain our diagnosis and discuss your options, which include lifestyle changes that may apply to you around weight reduction, avoiding alcohol and smoking, and addressing dietary modifications. The rationale is the imbalance between stomach protection and irritation. Bear in mind your mood can exacerbate indigestion as well. If your predominant symptom is heartburn without any alarm symptoms, we would offer you acid-suppressing medication called proton pump inhibitors for a month. If this works and you no longer suffer from indigestion, we'd step down your treatment, maybe to take the medication when required only for another month and then stop it. If your stool sample was positive for the H. pylori bug, we would offer you an eradication therapy. This bug has been associated with stomach ulcers and some cancers. If you combine the bug with smoking, alcohol, and obesity, your risk of these complications is higher. We would consider further investigation based on your age if you are more than or less than 55 years, the severity of symptoms, and the presence of alarm symptoms. If you reported alarm symptoms, you would be referred urgently for an endoscopy to be done within 2 weeks, otherwise at any time after the first 2 to 6 months. If you still have persistent symptoms despite treatment, we would consider referring you for endoscopy, which is a camera test to directly look at the lining of the stomach wall. Most people would improve without needing further investigation. If your symptoms reoccur, we can repeat the treatment, so you don't have to let indigestion rule your life. Seek help and support from your primary care team. Thanks for watching. Like and subscribe to my channel for more educational videos.